Hello, and welcome to the Orthodontic Products Podcast. I'm your host, Allison Warner. In this episode, sponsored by Ormco, we're going to talk about how the company is responding to orthodontists' evolving needs and how it has created a comprehensive product portfolio that aims to empower orthodontic providers to utilize digital workflows and better address patient needs rather than simply selling what they have always sold. And to do that, we're joined by Dr. Colby Gage. Dr. Gage is a board-certified orthodontist with a private practice, Level Up Ortho, in Parker, Colorado. He serves on the orthodontic faculty at Western University of Health Sciences, his dental school alma mater, and lectures on digital orthodontic systems and practice management topics, the two topics that will be at the center of our conversation today. He is also an Ormco insider and a paid consultant for Ormco. Dr. Gage, thank you for joining me.
Yeah, thank you, Allison. This is quite a pleasure, and I love talking about what makes our practice different in various forums, whether it be in dental schools or to orthodontic residents. But this has been a really great change that we've seen in the industry recently, and I'm excited to discuss it more.
Great. Okay, so to get started, tell me about your practice. But first, how long have you been in orthodontics and how did you get where you are today?
That's great. Well, I graduated 10 years ago from A.T. Still University. I initially took a job in Canada and had a practice up there, and then wanted to come back to the United States and be closer to family. So I did a startup in 2020, which is the best year to do a startup, right? No problems at all in 2020. So a little, slow start with various things, but it's been absolutely awesome. I caught wind of a lot of new products and new things that Ormco was doing. As I made that move and transition, I was looking to partner with a company. I really wanted a company that was moving in new directions, that had new innovation, and it was investing into their products. I didn't want to just use the same stuff that I was doing, and I wanted to create a practice from the ground up that had a strong brand presence that was specifically geared towards results. I think I would, reach that part in my career where I really cared more about the end results than I necessarily cared about just, getting more patients in the chair. And I wanted to make sure that when I did pick a company that it had a full breadth of products that I wanted to use, and that those products were cutting edge and that they had systems around them so that it would make it easier to train my team members and have just an overall higher efficiency. So it really made a lot of sense at the time to partner with Ormco as they were making a shift in their products and helping to address the needs that I had. It just really helped a lot. And I think the next thing was that I wanted a company too that took a lot of the needs of orthodontists and residents into consideration. And that was how I first got started with Ormco, was lecturing to residents.
Okay.
And they saw that need and that shift, and they were willing to do it. And that's kind of, the rest has been history now, lecturing for them for the last couple of years.
Okay. So as you mentioned there, you do lecture frequently and often on digital workflows and practice management. So you've seen and talked about how the field has evolved over the years. What are the key trends shaping the future of orthodontics as you see it?
Yeah, when I opened up Level Up Orthodontics in 2020, I had come from a very heavy aligner practice, and I kind of thought that aligners were going to be the mainstay of my practice, that the digital aspect from plastic would be the main modality that my patients would request and that I would recommend for patients. And I noticed that more and more adults were choosing braces over aligners. And I also noticed that the amount of money that patients were willing to put down also was lower. So you kind of have to be a little bit smart about how you're looking at patients' finances and making sure that if you're going to get maybe fewer consults or see maybe less patients, how can you make sure that the conversion rate is there, so that you're actually converting the patients that are coming in, and that you're creating an environment that attracts the right kind of people, right? So that we want to make sure that everything from our branding, our messaging, to the products that we use is reaching those clients that we know are going to build our practice from the inside out, because we can't rely as much on outside referrals. And I think that's been the biggest trend that we've seen, is that we can't just assume that the dentist that we've known for 5, 10, 20 years is going to be there. We're seeing consolidation from DSOs that are taking some of those referrals away. We're seeing more and more pediatric dentists that are bringing orthodontists in. And then we're also seeing trends where, now that the practices are getting bigger, those revenue markers are getting higher, but we're also seeing the expenses creep up. And so our staff expenses are higher than they used to be. We have record inflation. And so all these trends kind of piece together a practice where we have to all level up in how we practice to make sure that we're not falling behind in some of these metrics.
So talk to me about what metrics you are tracking as you go along.
Yeah, so there's lots of different ways you can look at a practice health, and
Hmm.
I use Gage Ortho, and they're kind of a analytic software that
Yeah.
pulls out data from practices, and I look at their data and what they're putting out to really help me understand what's going to drive my practice. And they've identified multiple things, both market trends as well as trends within the field. They can pull out things like average treatment time. The average treatment time kind of surprises people when they hear the average treatment time in the U.S. is 27 months for your typical braces patient. Most of us quote 18 to 24 months, right, to our patients. So clearly, right off the bat, there's a little bit of a disconnect between what we think we're doing and what's actually happening.
Okay.
And so when we look at those key data factors, I think one of the main things is value per visit, is how much revenue do we create per visit in the chair, and keeping that number as high as possible is what's going to keep our practice healthy. The other one is making sure that our starts equal our D-bonds, or in another way, that our patients aren't going over treatment time, right? Because if they're going so far over treatment time, those are the people that we need to focus on to get them out of treatment so that we can become profitable again. And then finally, just making sure that every day that we're in the clinic, we're starting as many people as possible. So our starts per day worked, that metric typically needs to be higher than 3 per day in order to get the maximum benefit of our practice. And many days, we'll see offices that will get 5, 6, or 7 starts in a day. And that comes down to TC conversions and making sure you're attracting the right people. So those are the metrics that we've been really focusing on this last year. Our conversion rate now is over 90%, which is really incredible. We've had a lot of success in helping identify the right people. Our actual value per visit in many cases exceeds $1,000 for aligners and is around the $700 mark for braces. So you're looking at that compared to the averages that Gage is showing around $300 using the products that we've been able to bring over with Ormco. We've been able to really, really do much better than that, to the point where I'm not so worried about, the incremental cost of a bracket or, the materials I'm using, because my profit per visit or value per visit is so high. So,
So talk
yeah.
to me a little bit more specifically about how that data, started there. Talk to me a little bit
Mhm.
more about how that data influences your product choices.
Yeah, so when we looked at, the products, I learned a lot about efficiency, learning from Dwight Damon and going to some
Hmm.
of the Ormco meetings. Ormco throws some great educational events with lots of different speakers with different backgrounds. And I went to a lecture early on when the Damon Ultima bracket was first launched, right around when I opened my practice. And I could see that there was somewhat of a recipe to follow to get these great results. And when they showed how each wire does something a little bit different, I think the Damon Ultima system is quite unique in that by typically the third wire, we've completely controlled all of our rotations. We've created a beautiful arch form, and we're getting a lot of the early expression that we weren't getting in previous systems with a lot of control as well. So getting to the point where picking the products that I knew would have a predictable result helped me to reverse engineer and say, okay, if I can get my treatment times down and make sure each visit is valuable, each visit actually moves forward the treatment, then I know that I'm not going to have a problem with patients going overtime. I'm not going to have a problem with staff not understanding what's next, right? If they can follow that kind of cookbook or that recipe, I know that the results will follow. And so when I learned about the Damon Ultima system, that was initially what drew me to it, or had that initial attraction, because I didn't want to be just doing the same things I was always doing. I wanted to make sure that I was, getting these patients treated faster and with better results.
Well, you mentioned staff there, and I want
Hmm.
to kind of take the product question a step forward, because
Yeah.
you make a decision whether to purchase a product or try it out. But
Hmm.
then you have to actually make the decision whether to integrate it. And that's
Yeah.
the decision that affects the workflow for you and for your staff.
Yeah.
So how do you know when it's time to fully integrate a product
Yeah.
into your practice?
Yeah. A lot of times, you might hear just around with orthodontists, they say, oh, I'm going to try a bracket out, or I'm going to
Hmm.
try a couple cases. And for me, I did the due diligence of researching the different brackets that were out there, and we jumped right in. We went 100% in with Damon Ultima when it came out. We were the first office in Colorado to bond it, and subsequently also trialed Spark as well, and used that exclusively in our practice now. I think for when you're looking at a practice and what matters to them, I think you have to look at, what your talents are, what things draw your patients into the practice. If you have a lot of patients that really value good quality service, quality products, want to do things one way, the right way. They don't want to revisit things in the future. They're going to value the brand that the Damon Ultima system or that Ormco has created. They're going to value that higher touch and feel and finish. And when I'm thinking about my own, my own team, I want to make it as easy on them as possible. Typically, we put our team first, right? Even ahead of our patients, because we know if we take care of our team, they will take care of our patients, right? And so if I have a product that's easy to use, that has good wires, good bracket doors, are easy to place in position, and it has a sequence or a system attached to it, I know that it's going to be much easier to train a team member on that versus essentially something that I kind of put together in the garage that's maybe, older than me, that doesn't really have a cookbook or an actual recipe to it. So all of those things, together, I knew I wanted the results that came with the bracket, and I saw the results in those lectures, and I was inspired, and knew that that was the direction I needed to take. So I think when I just take a step forward, that initial step can be a little bit hard, and sometimes feeling comfortable to do any integration, it's a team effort, right? So when I took the team to some of these meetings and really said, "Hey, these are the results that we want for our patients," right? And we all kind of agreed, yeah, this is what we want. Then from there, the rest of it was easy because we knew that the steps that we had to take would follow one after another, and we would get to that destination, which has been really exciting.
Okay. So talk to me a little bit more about your digital workflow. How
Yeah.
has that workflow kind of impacted your practice and the products that you're integrating there?
Mhm. Yeah. So the digital workflow, when we typically think about digital workflow, we think about aligners. And
Yeah.
one of the things from my previous practice in Canada, we did all indirect bonding, and we did it in-house without the digital aid
Okay.
to help simulate where the teeth would go.
Hmm.
When I heard about Ormco digital bonding that was going to be coming out about a year or so after I opened my practice,
Hmm.
I immediately said, okay, this is the product I've been waiting for. This is what I want to be able to treatment plan my cases, just like I do with an aligner case.
Yeah.
So when I take a look at my practice and the day to day of what I'm doing, I want to make sure that my activities in the practice are revenue generating, and
Hmm.
that I'm not spending a lot of time, going back and looking at things, or, spending time treatment planning, but it doesn't get recorded correctly, or, doing extra work that doesn't actually make the patient's experience better. So with the Ormco digital bonding, what I've really enjoyed is that I can visualize the patient's smile before they've even started treatment, and I can plan things like IPR or plan the recontouring of the smile to create something truly unique without being distracted at the chair when I have, five different things going on at once, right? Or I'm worried about the patient's hygiene, or there's a broken bracket. It kind of frees me up from a lot of those distractions and gives me some time, which I typically spend about a half an hour before lunch doing this. And I have an assistant with me who's helping queue up the cases. And then we're looking at the notes at the same time on two different screens. So that if the patient said something particular in the consult, that I didn't miss it in the planning stage. And then from there, we just execute the plan.
Okay.
So it actually speeds up the chair time and the whole process for the patient, but it just gives me about 10 minutes of focused time to make sure we, dot our I's and cross our T's before they're even there. So it's been a huge game changer in my time and keeping me focused and more of an architect rather than a construction worker in the practice.
That's a good analogy.
Yeah.
Okay, so you've talked a lot there about Damon Ultima and
Hmm.
ODB, which are on the
Yeah.
bracket side. Talk to me a little bit more about how you're using aligners in your practice. You did mention that you're using
Hmm.
Spark.
Yeah.
Talk to me about that.
Yeah, when I first came to the practice here again in Parker, Colorado, I had to use another aligner company, and I decided to trial both at the same time in my new
Okay.
location to see kind of how they would match up. The first thing I noticed with Spark is that the patients really liked the clearer plastic, and they felt that the fit and finish of the trays was better than what they had previously experienced. So just from that initial trial of 100 patients that I did with both companies, the overwhelming majority wanted to use Spark because of just those simple manufacturing changes.
Hmm.
What I noticed clinically was that the cases tracked better, that I didn't have as many refinements, and I wasn't struggling as much with as many attachments or difficult movements that I had to do previously. So that initial realization took a little bit longer to see how the actual cases would treat out. But from the encouraging feedback that I got from patients in the aligners, and then over the first maybe 2 years using Spark in my practice, I saw tremendous results that I wasn't seeing before. And going back to that Gage data about value per visit, we're typically able now to finish our aligner cases in anywhere from 5 to 7 visits in person, which puts our value per visit closer to $1,000 or sometimes higher with our current fees. So at that point, it's a win for everybody because I know my patients love coming into the office. We have arcade games and, we try to make it fun, but ultimately they're happier if they don't have to come in, right? And so by not coming to the office, we're making more money, they're happier. And so it's a win for everybody.
Okay. So
Yeah.
as we close out this discussion, what are kind of the key takeaways you want doctors to have from this conversation when they're looking at integrating new products into their practices?
Mhm. Well, doctors have a lot of different hats that they have to wear. We have a
Mm.
clinician hat, we have a CEO hat, we have a technician hat, even sometimes we have to do lab work. I mean, there's so many
Yeah,
things that orthodontists choose to do or that do as part of a modern practice.
yeah.
And I think we don't have to think of them being mutually exclusive. It's not that, oh, well, this doctor's a really good business person or this doctor's a really good clinician. I think both of those can exist at the same time. And so when we're looking at products to use, I would look at products that have a good reputation, that have staff and salespeople that can support and help train your team. And then also a company that is investing in all the various aspects of your office. We don't want a company that just has one product to sell. I'm thrilled to use Ormco because now I have one rep for both my aligners, my digital braces, and just my regular bracket orders. So I'm not going to, 6 different companies to piece that together.
Okay.
Um, on top of that, with understanding the business side versus the clinical side, I would say if you're looking at the different products to use, try to find something that meets all of your needs. Looking at that Gage data, for example, if I can be really efficient and decrease the number of visits, and I can finish patients faster, then I know I'm going to be more profitable and more able to do all the other things I want in my practice. Whether it means taking an extra half day off a week because I don't need to be in the clinic as much. In certain areas, areas in the United States, you can have certain adjustments done by the assistants, and you don't need the doctor there, or you need less oversight. And there's so many opportunities for that with these products, particularly the digital setups and the digital bonding, that I feel confident that if a doctor's willing to try to redesign their practice from the inside out, if they partner with Ormco with the products that they have now, they'll have the easiest time that they've ever had jumping in and taking that step to make their practice more efficient than ever before.
Well, one more question before I let you go.
Yeah.
What excites you about the future of orthodontics?
Oh, that's a good question. I mean, I think all of it's exciting. I think the best part for me is knowing that I'm getting results that I've always wanted without having to put extra work in. And maybe that sounds like I'm just a procrastinator, right? Or that I maybe don't want to do as much of the hard work. But when I was in school, when you see people bending wires in 8 different planes and trying to put that in the patient's mouth and not mess it
Yeah.
up, that was difficult for me to realize that, hey, if that's what it takes to get a good result, I know I can develop that skill, but I don't have it now.
Mm-hmm.
Now, when I show the results that I'm getting and I see the results from the Damon Ultima system, I realize that's not required anymore to get a beautiful result.
Okay.
That's exciting to me because the more doctors that put in the time and effort into learning these systems and the
Mm-hmm.
more that they share, the better that we all get. So we don't have to be this island where each doctor is just has their own best practices and keep it to themselves for some type of competitive advantage. Now we can all pool what we're doing together to make it better for everyone. And that's when we all win. That's when we all have the best experience of our career. So for me, the most exciting part is just understanding where the future is going to be when we all work together. It's just way better than I ever thought it could be.
Well, I think that's a great note to end on. Dr. Gage, thank you
Uh,
so much for joining me. I really
oh,
appreciate it.
thank you so much for having me.
Great. As always, thank you for joining us. Be sure to subscribe to the Orthodontic Products Podcast to keep up with the latest episodes, and be sure to check out orthodonticproductsonline.com to keep up with the latest industry news. Until next time, take care.